This is One-on-One. Steve Adubato here on the campus of the New Jersey Institute of Technology. We've just finished a really exciting forum on the ACA, the Affordable Care Act, talking about the final days before the first enrollment period to sign up for the exchange. It's so important. I'll tell you what, a lot of interesting comments back and forth by a group of experts, and Wendy Sykes is one of them, director of the Oranges ACA Navigator Project. We also had folks in the audience who asked some great questions as well. Wendy, let me ask you, what do you take away from a discussion like this, where so many people had questions and wanted to understand more about the exchanges in the ACA? What do you take away from it?
That the information is very important. It's still important to get out there, do community events. There are still a lot of questions. There are, no matter how many events we seem to do, we come across individuals with the same types of questions.
Like what?
Like the questions that some of the students here had, should I have health insurance or I'm losing my job? Where do I go to get health insurance? Just different things like that. And then we had questions about how long can I stay on my parents' plan? And just the Affordable Health Care Act law in general.
But here's the other thing you said. Wendy was saying as part of the panel that sometimes people come into her place and ask questions about, hey, I'm not a citizen. Am I eligible for the ACA on the can I enroll under the exchange? How about this? I served time in prison. All kinds of other questions. Talk to me about that. Those are questions people want to know about. And by the way, what are the answers?
And those are our different populations that we deal with at the grassroots level. These are individuals that are not used to having health insurance, and so these are individuals that have a right to have those type of questions. They're not sure about what the law says.
Does that mean sometimes they avoid even coming in because they don't know and don't want to even talk to anyone potentially connected to the government?
And that's the reason why we have food that usually draws people in, because we need to get them in so that we know what are your questions, what is your situation, and how can we help you navigate through that situation to a point to where you're covered somehow, either on with the NJ Family Cares or through the marketplace with the Quality Health Care Plan.
So interesting. We were talking about the fact that as of right now, when we do this program, about 75,000 people in New Jersey of the 350,000 who are eligible under the Affordable Care Act to sign up for the exchanges have actually done it. That's about a quarter, my math, maybe less than that. Disappointed by that?
The numbers, a little bit. But you have to realize that we knew that the work was going to be great. And we knew that we had a challenge up there. We're proud about the numbers that we actually achieved. But being on the grassroots level, we know that there are so many more people out there that need insurance. And so the communication, just getting them to understand that, listen, it's available to you, come and get it, ask the questions that you need. And we talked about another factor, which was trust. And
talk about that trust. That was a whole theme tonight.
Mm-hmm. That's why you need face-to-face communication, just like I'm talking to you right here. Individuals that can identify with someone that looks like them, sound like them, talk like them, they're more willing to trust you and trust the information that you're giving them, and not think that they're going to be caught up in some type of a scam, number one, or misinformation.
Language a barrier too? Or an obstacle or challenge?
Language, most of the time, is an obstacle and a challenge, but that's something that we did foresee. And at the Oranges ACA Navigator Project, we have individuals that can communicate with our consumers in the areas that we deal with in their own language. In addition to that, we didn't talk about the healthcare.gov website, but if you're computer savvy, you can actually go on the website yourself and start your application before March the 31st.
But let me ask you this. We're doing this and it'll be seen after March 31st. But we have folks who are right there, and we'll get some shots later of this, in the back of the room, who are experts, who are helping folks navigate, as we speak right now, that website, going through it. For a lot of folks, it is overwhelming, that healthcare.gov website. You can understand that, right? Absolutely,
especially if you're not tech savvy. It can be overwhelming just going on the computer to check your email. I mean, so like I said before, we're here to do face-to-face assistance. For those that are tech savvy, you can get on the website and at least start your application before the deadline. You may not get through the entire process. You may have to wait for eligibility, but at least you're registered as having applied before the deadline.
Let's talk about after the deadline. Again, being seen after March 31st on public television. Let's talk about the fact that there are some areas that if you fall into these, I don't know whether we call them hardships or certain special circumstances, even if you've missed the March 31st deadline, under certain circumstances, you still have the opportunity to try to enroll under the exchanges connected to the ACA. Describe that.
Right, those are extenuating circumstances, and so
Such as?
And so I was just going to give examples. If you get married, if you have a family addition to your family, if you lose your job, or if you become a citizen. Under these circumstances, you can apply for some type of quality health care plan through the Marketplace Exchange after the open enrollment period.
And people don't know that. A lot of people don't know that.
A lot of people do not know that. So, this is the type of information that we are really trying to get out to them.
One more thing before I let you go. Medicaid expansion keeps going, right?
Medicaid expansion does not end. It's a rolling enrollment process, and so we can do it all year long. There is no deadline. That does not, that's not in conjunction with the open enrollment deadline.
Wendy, let me ask you this. What would you say the biggest lesson we've learned from this first effort to enroll people under the ACA has been from your perspective? Because you're on the front lines. Biggest lessons.
Well, in the beginning there were glitches, and so we were trying to just get through that hurdle. But after that, once the marketplace started rolling, the biggest lesson is just to remain open and remain there for follow-up for individuals, because it's not over once you pick a plan. It's not over once you are deemed eligible by the marketplace. And so you still will need somewhere to go to do the follow-up, to say, listen, I have my card. Where do I go? What do I do? Because, again, these individuals, our population is not used to having health insurance, a lot of them. And so once they get a health insurance card, you kind of have to guide them through. What do you do with it? How do I pick my doctor? We at OACA the Oranges ACA Navigator Project, will do that. We'll assist you with some type of, guidance.
Can't just walk away.
No.
You can't say, hey, we're done. You already signed up. I'm out of here.
Right. We don't want to do that. We want to make sure that there's a connection, that they're actually using the plan that they pick, and that the plan works for them, so that maybe, if it doesn't, maybe the next open enrollment period, they can change, insurances or whatever they need to do. But we want to be there, and we are there for individuals that need that follow-up.
And remind folks one more time, the next open enrollment period is?
Next open enrollment period for the marketplace begins November 15, 2014 through February 15, 2015.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, Investors Bank, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, PSE&G, committed to improving New Jersey's economy and strengthening its communities. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.